Could you start off just by telling us a bit about your job and what you do?
Mm-hmm. My name's Asya Ali. I am the Mental Health and Substance Misuse Project Officer for REACH Community Health Project. The organisation is involved in conducting research and influencing policy around health in Black and minority ethnic communities. We also deliver culturally competent services to grassroots communities across Scotland.
What does that mean? Can
Well,
you say a bit more about that?
At the moment at REACH, based here in Glasgow, we provide work around mental health awareness and tackling stigma amongst the Black and minority ethnic communities, and we're also doing work with youth around substance misuse awareness in schools. We've also got a gym facility and keep fit classes, and we're also doing a programme on get shopping, get cooking as well.
Are there any kind of ways that you would deliver those services that might be a little bit different to make them more culturally sensitive?
Yeah, we use a very flexible approach in the way we deliver services. That could be that we have services in evenings and weekends, if that's a need by the community. We also have a no appointment basis, for example, for some of our services. So, because a lot of communities don't understand the concept of appointments, they just like to turn up.
Right.
So we have an open door policy, for example, or drop-in sessions. And another thing that REACH does is when we do have an event or a service, we do call our participants beforehand to remind them, and we found that that's quite useful for them.
Okay. So what would you say are some of the main challenges in engaging people from the Black and minority ethnic communities?
The challenges vary from service to service within the NHS. For example, it could be different for a GP service, as well as it could be different for frontline staff in primary care. Some of the challenges that we found through our research has been around awareness of services. Not many people are aware of NHS services. From a research done for NHS 24, we found that 80% of those asked had not heard of NHS 24 before.
Why is that?
It could be due to services are not promoting themselves well amongst communities, i.e. Information is not accessible in their language.
Right.
There's not many links between service provider and the communities, an established link, and also there could be basically a lack of understanding and trust factor, because we found that Eastern European communities tend to go home for treatment rather than getting treatment from the NHS, and that's just basically down to trust. Other factors that influence that are also around cultural and religious aspects as well. If you're delivering a service and some of the cultural factors are women only, like women and men don't tend to mix. So you would deliver that service specifically for women,
right,
and at a different time for men as well. Or, talking about health sometimes is a sensitive matter, especially if it's a particular health aspect. Some people don't feel comfortable talking in the same room about a specific health matter with men being in the room,
Sure.
Or women in the room, and they would rather be doing that on a one-to-one basis or in a smaller group setting.
What sort of communication do you find works best with the group you're aiming at?
We use quite a different approach to communicating with communities, and it's not a set approach, it's very flexible. For example, when communicating with a hard to reach group, we tend to find that even establishing a link in that community, a key community representative, establishing a link with him or her, actually makes it quite easier for yourself to engage with that particular community. When we send letters, we translate the letters into the different languages because there is a literacy issue. And we also telephone a lot of our service users to inform them of anything that's coming up in the future.
You know, you were talking about this link person, that it's useful to find somebody who can be like a bridge into a particular community. How do you go about finding that person?
What works best, what has worked best for myself is actually getting into that community, visiting places, going to places of worships, voluntary and community centres, and talking to the people there about, you know, the work that you're doing. They're always a great help of actually referring you to somebody who has done some work in that community, from that community. And then it's just basically contacting them and seeing if you can establish a link with them, because you always find there's somebody who's got the knowledge, the understanding and experience of working with the community who is from that community. You'll find them somewhere, and it's just actually trying to meeting them and bringing them on board.
So if you were going to give a bit of advice to the people who are on this course, what sort of 3-4 practical things would you suggest?
I would say firstly, get in touch with voluntary and community sector organisations that work with black and minority ethnic communities and get their advice and support from the very beginning.
Right.
Always conduct an initial assessment beforehand to ensure that the services are culturally and religiously competent. Establish links with communities. Ensure you're always feeding back whatever you're doing to the community, and basically establishing links with voluntary sector organisations to inform them of the services that you provide, informing groups that meet together, make a point of actually visiting them and informing them of the services that you provide, and having interpreters and accessible information available.
Okay, thank you.
Thank you.